Welcome to my home. So, when I was an adolescent, I was really interested in health. I exercised constantly. I ate what I considered a nutritious diet. I explored all the different supplements and how they could help people with different things. And ultimately, I decided that I wanted to pursue a career in health. And I wasn't sure what that originally or what that meant at the time, but I knew I was interested in health and I knew I was interested in helping others. And so I explored all sorts of different areas. At one point, I was interested in being a chiropractor. I was interested in being a nutritionist or a dietitian. I was interested in being a physician, a surgeon, a dentist. I really kind of explored all the different avenues trying to find what I would like for a career. Now, ultimately, I did go to medical school and I became a physician, and now I'm an anesthesiologist. And along the way, I had to really consider, did it line up with my original goals, which was providing health to others? Now, I think that you need to think about what is health. And I think it's more of a philosophical entity rather than something that's really clear cut. We try to break it down into categories. So we have physical health, mental health, financial health, spiritual health, sexual health, etc. But I think that from a definition standpoint, to me, what health is well-being over prolonged periods of time. Now, throughout my training and everything, I've always asked myself, am I providing health? And so I think we have to think about, well, what does the medical system here in the United States do well? And as far as providing health, and I would say that things we do really well are our vaccination programs. I think that we have good standards as far as clean water and things like that, to prevent infectious disease. I think that we do a really good job of screening for childhood illness. But in general, I think that we may not necessarily be so great at providing health. Now, what does the United States healthcare system do well? We do a lot of things well. If you are having a heart attack or about to have a heart attack, we can put a little stent in the vessels of your heart. We can do major cardiac surgery with great outcomes. If your joints start to wear out, we're really good at replacing joints. As far as cancer care, we're probably among the best in the world. We have MD Anderson and Memorial Sloan Kettering, so we're at the forefront of cancer care. But when you look at metrics, our communities are not very healthy. And so I think that we have to take a step back and say, well, what does it mean to be healthy? And I think that as a physician, like I mentioned, we're really good at solving problems, identifying and solving problems, taking care of things that already exist. But what we're not good at, and maybe we're not the most suitable group or profession to deal with this, is the prevention of these problems. Now, where do these problems originate? I would say that the vast majority of the issues that I deal with and the complications of all these issues stems from obesity. In the United States, we live in general, live a very sedentary lifestyle. We have a very non-nutritious diet. And so I think that those play a big factor in someone's health. What else plays a factor in someone's health? I'd say that having a strong community, as far as having a good social support, living a life of less stress, and then, like I mentioned, getting up and moving and eating a healthy, nutritious diet. So, because I'm still interested in health, I've done a lot of research looking, looking at the scientific literature, to try and figure out how do we achieve health. And then mostly I'm doing it for my own personal benefit. I want to be healthy, and for my children's benefit and my wife. But at the same time, I still have the goal of providing health to others, or at least helping them become more healthy. Now, I am an anesthesiologist, and don't get me wrong, I love my job. I am very passionate about what I do, because I think that as an anesthesiologist, I have the best job in the world, because what I do on a daily basis is relieve pain and suffering. I protect people during their most vulnerable period of time, which is when they undergo surgery. So my focus is to keep them comfortable, but more importantly, to keep them safe. I happen to be a pediatric specialist, and so I think it's the highest honor to take someone else's child who's having an issue and keep them comfortable and safe when they undergo surgery. And so I wouldn't change anything about my career trajectory. I'm very happy and very passionate about what I do, but I often wonder, am I providing health? And so I created this entity, Simple Natural Health, to try and help with these issues, to try and explain to people my own philosophies, what we can do to try and help people achieve health. And so I hope that you continue to watch, and we'll explore these different avenues together.